There you go.
Think we have like about half of the folks who registered, so maybe just 2 more minutes and then we can
Mm-hmm.
get one here. Okay, it's 5 after. The waiting room is definitely quieted down. So if you'd like to
Okay.
take it away, Janine.
Alrighty, so we'll get going. Good morning, everyone. Thank you again for participating in the quarterly meeting for the Long Island Health Collaborative. I'm Janine Logan, Director of the Collaborative and also Vice President Communications and Population Health for the Suburban Hospital Alliance of New York State, which includes the Nassau Suffolk Hospital Council representing hospitals on Long Island and the Northern Metropolitan Hospital Association representing hospitals in the NORMET region. And it is the hospital council that manages and supports the Long Island Health Collaborative as an initiative on behalf of the region. So, all right, so that's me. So we'll go around the room. We'll go around the screen. And Brooke, I'll hand it over to you and I'll call out who I see as they appear on the screen.
Thanks, Janine. So I'm Brooke Oliveri. I'm the Associate Director of Communications, Marketing, and Public Health Initiatives for the Nassau Suffolk Hospital Council and NORMET, as well as the Suburban Hospital Alliance, as Janine outlined. And with Janine, I manage the Long Island Health Collaborative under her leadership.
Hannah?
Sorry. Hi, everyone. Hannah Moore, Director of Community Health Strategies for the same organizations Janine and Brooke just mentioned. I help to manage the case study subgroup this year for the Long Island Health Collaborative and jump into any other collaborative initiatives that I can assist with.
Thanks, Hannah. Pablo Alvarez?
Good morning, everyone. Hello.
Morning.
My name is Pablo. I am the Community Outreach Specialist for the Cancer Services Program here in Suffolk County.
Oh, nice. Gary Carpenter.
Hey, good morning, everybody.
Morning.
My name is Gary Carpenter. I'm the president of my own corporation. We are a New York State-wide management consulting firm for the home healthcare industry. What we do throughout the state of New York is represent providers, my company does, and individually I help people throughout Long Island navigating the maze of home healthcare, what to do. In my spare time, I sit on the board of St. Catherine's of Siena Medical Center, part of Catholic Health System, and I head all the activity for the Multiple Sclerosis Society in Long Island.
Good. Nadine, hello.
Hi, good morning, everyone. I'm Nadine Welches, president and founder of Mind Arc Health. We predict and prevent mental health and behavioral health problems using preventive technologies and are affiliated with Stony Brook University's ecosystem.
Very good.
Good morning. Pam, how are you? Pam Mizey.
Good
Mizzy.
morning. Good to see you, Janine. My name is Pamela Mitzi. I am a KSAC and a licensed mental health counselor, but right now I'm the director of the Long Island Prevention Resource Center here at Family Service League. Thanks.
Good to see you, Pam. Georgette, good morning.
Good morning, everyone. I'm Georgette Beal, Senior Vice President for Planning and Grants Management at United Way of Long Island, and I oversee the Ryan White Part A program for Nassau and Suffolk counties, as well as our Youth Build program.
Haley Boyle.
Hi, good morning, everyone. My name is Haley. I am the Injury Prevention Coordinator at NYU Langone Hospital, Suffolk in Patchogue.
Sabrina Tehran, if I'm saying that correctly.
Yes. Good morning, everyone. My name is Sabrina. I am the owner of Comfort Touch Health Agency here in mainly Suffolk County, but hopefully exploring Nassau County as well.
Okay. And Deborah Merced. You'd have to unmute, Deborah.
There we go.
There you are.
Good morning. My name is Deborah Merced, and I work for the Centers of Medicare and Medicaid Services, and I'm replacing Frank Winters, who used to join the meetings.
Oh, okay. Nice to meet you.
Same here. Pleasure.
Hi, Zareen.
Good morning, everyone. Nice to be back. So I'm Zareen Bajwa. I'm the Director of Community Education with Cornell Cooperative Extension at Suffolk. And we have a lot of programs that actually are with nutrition, human development, diabetes prevention that we do in the community. Thank you.
Ryan DeFilippis, if I said that correctly.
Yes. Can you hear me?
Yes, we can.
Okay. I apologize that the video doesn't seem to be working, but I'll get that fixed. My name is Ryan DeFilippis. I'm the Public Relations Director for the Suffolk County Health Department. I'm replacing Grace, who retired a couple of weeks ago. So
yeah,
I have some experience doing this with the Suffolk Police for many years, but this is the health world is all new to me in the last week or so. So I'm learning a lot about health. So I'm excited to be here and learn more.
We're happy to have you. Yes, and I was there to say farewell to Grace a couple of weeks ago. So
yeah, she's been very helpful.
Yeah, she's great, and you're in good hands here. There's a lot of great people will help you, and all of the individuals on this call and in this group are always very helpful. But great that you could join us.
Excellent, thank you. And again, I'm sorry about my camera.
That's okay. I hope I say this right. Emily Galvez.
Yes, you did.
Oh, wow.
Very good job. My name's Emily Galvez. I work with the Epilepsy Foundation of Long Island, and I am a bilingual community educator for Nassau and Suffolk counties.
Excellent. Good morning, Kelly DeVito.
Good morning. I'm Kelly DeVito from Horizons Counseling and Education Center, which is an outpatient treatment and prevention program.
Nice to have you, as always. Dr. Linda Mermelstein.
Hi, I'm Linda Mermelstein. I'm the Associate Director for Community Outreach and Engagement at Stony Brook Cancer Center and formerly worked for the Health Department for 22 years in Suffolk.
Yeah.
Thank you.
Samantha Summers.
Good morning, everyone. My name is Samantha Summers, and I am the Nutrition Resource Manager at Long Island Cares Food Bank.
Wow, nice to have you. Let's see, people are jumping around here. So Christine Hendricks.
I turned my camera on at the right time.
Yeah, no, you popped to the top of the list here.
Oh, there you go. Maybe because I turned my camera on. So I'm Catholic Health System Vice President for Community Outreach. Happy to be here.
Great to have you. Sarah Narcisse?
Good morning, everyone. I'm Sarah Narcisse. I work at the Office of Epidemiology, Biostatistics, and Planning at the Nassau County Department of Health.
Great to have you. Alana Jenkins?
Hi, good morning, everybody. My name is Ilana Jenkins, and I also work in the Epi Biostats office at Nassau County Department of Health.
Great to have you. Emma Young or Young?
Young.
Which is
like Y-O-U-N-G, Young. But hi, nice to meet you. I'm part of the Be Free team at Northwell, and I'm excited to be here.
Good. Irene Rogers?
Hi, good morning. I apologize for being off camera. I'm in my car, but I am the chief I'm the Chief Development and Engagement Officer for the EPIC family of human service agencies, which includes Epilepsy Foundation Long Island, South Shore Guidance Center, and EPIC Long Island. And we provide services for people with intellectual and developmental disabilities, epilepsy, and mental health services and substance use.
Glad to have you. Aaron Zeller?
Glad to be here.
Thank you.
Hello, I'm Aaron Zeiler. I'm the Director of Strategic Communications for the Office of Health Equity and Climate Medicine Research at Stony Brook.
Oh, nice to meet you.
Nice to meet you.
Nancy Fisher.
I am with the Nassau County Department of Health. I was previously with Emergency Preparedness for 11 years, and we have just joined the Community Health Group division here as Director of Special Projects.
Okay, thank you. Welcome. Julianne Roman?
Hi, my name is Julianne Roman. I'm Associate Director of Community Partnerships for the American Cancer Society. And in my role, I support community organizations on different cancer health initiatives from prevention and early detection through to survivorship.
Good to have you here. Christy Golden, how are you?
Hi there, Janine. How are you?
Hi there. I see you got your grandmother too now, and I am too.
I am a grandmother of two. It's wonderful.
Yes.
I am Assistant Vice President for Operations at Stony Brook for the Neurosciences and Psychiatry Service Line.
Great
Thank
to
you
see
for
you.
having me here.
Of course, Christy. Josephine Peterson. I know she's with NYU Langone. There she is.
Everyone, I apologize that my camera is off. I'm not feeling 100% today. Yes, I am. Thank you, Janine. I am with NYU Langone Hospital in Mineola. I work with the trauma center in their as their injury prevention and outreach specialist. And I'm so excited to be in this meeting today. I apologize. I've missed the last few.
That's okay. Greta Guarton. I do like your photo.
There, can you see me? Okay, thank you. That photo is my dog Milo, who is a therapy dog and comes to work at our community center on a daily basis.
Nice.
And he likes to wear tuxedos. Hi, everybody. I'm Greta Gorton. I'm the Executive Director of Long Island Coalition for the Homeless. We operate several programs, including street outreach teams that partner with Northwell and also Malloy for street medicine programs for folks in the field, for folks who are living outside.
Yeah, that program is phenomenal. I don't have any, did I miss anyone? Because I don't have anyone else to scroll. Anybody come in?
Hi, Janine. It's Janet Romeo.
Oh, did I skip you?
It's quite all right. It's
Oh my
fine.
goodness,
And I
sorry,
apologize.
Janet.
No, it's okay. And I apologize that my camera is off, but I'm glad I'm not the only one with no camera today. Anyway, I'm the Director of Epilepsy Services for the Epilepsy Foundation Long Island, part of the EPIC family of human service agencies. And I basically provide services for anyone in Nassau or Suffolk counties that has epilepsy or seizures or seizure disorder. I just wanted to also mention that we are currently working on an initiative to outreach to the Hispanic community on Long Island to educate and to support and advocate and provide resources for that community, and with the help of our bilingual community educator who introduced herself before, Emily Galvez. So,
Okay.
anyone interested in collaborating, we'd be happy to hear from you.
Did I call Irene Rogers?
You did. Irene was in her car.
Oh, that's right. Okay.
I think we may have missed Nancy Fisher. Did Nancy get a chance to introduce herself?
Nancy Fisher, I might have missed you.
Nope, I introduced myself. I'm with Health Community Outreach. Thank
So
you.
sorry.
That's right.
Thank you for reiterating.
Yeah, anyone I missed? Looking here, it looks like
I think that's everyone.
I think I got everyone.
Yeah.
Yeah, I think so. Okay. Well, thanks again for jumping on this meeting. I don't doubt we'll go to 11:30, so you have that to look forward to, at least. Get off a meeting early. So quick agenda, what we'll do is talk about the case study, which is moving along. It's moving a little slowly, but we're getting it done. We have some save the dates. We're going to talk about ongoing engagement, and we are going to look at the results of the 2025 Community Health Assessment Survey, the analysis and major findings, and then we'll have some discussion. So thank you all. So Hannah, you want to take it from here and talk about that case study subgroup? And those of you who are on the subgroup, I thank you in advance for all the work that you've done and continue to do with this.
Absolutely. So just a little bit of background. I believe now it was June of last year that we brought together a group of longstanding members of the collaborative and new members alike to really come together and write a case study about the Long Island Health Collaborative to really reflect on what we've accomplished as a group and how the collaborative really maintains its relevance and how it can move forward doing so. And really, we're examining the collaborative from the lens of a collective impact model and how that can be replicated in other areas. And ultimately, the goal is to produce an article for publication in a journal, of course, for everyone to take ownership of. And we are nearing the completion of the first draft. Like Janine said, it's been a little bit of a slow uptake. Every single time we think that we can get to writing, just things come up as it always does. But we are close to the first draft. We've completed really the main sections of writing a literature review about the collective impact model, the health and social environment of Long Island, and sort of building a framework for other community coalitions modeled off of how we've operated under the collaborative. So we'll have our first draft this spring, and we don't have any other formal meetings coming up. But we'll be sure to send out a version of the report once we have fully developed it. If you have any questions about the study, if you're interested, if you even want to jump in, whether it's the 11th hour or not, you're more than welcome to reach out to me or Janine or Brooke. But yeah, looking forward to bringing this all together. I think it's been a wonderful way to just kind of reflect on what has happened over the last 10 years of this collaborative, right, Janine? So it's been a learning experience for myself, who's been a part now of the group for 2 years, and looking back on how far the group has come. So appreciate all of the members who have been able to take part in it. And I know those longstanding members have really been able to develop the history of it for the purposes of the report, but new members alike just contributing in any way and providing feedback about building the report. And so we're excited for the final outcome. So thanks to all.
Yes. And thank you to Hannah and Brooke for all the work you've done on this as well. It's one of those tasks that we don't have to do, but we want to do very much so. And so because of that, it kind of gets edged out a lot of times, but we're hoping things slow down a little and we can really put our nose to the grindstone and pump out the rest of this. So thank you.
Absolutely. Yes, thank you all. And thank you, Hannah, for that great update. Next, we do have some save the dates here. The first of which is actually a save the date for tomorrow, which is a bit short notice for anyone who's on this call, but we did just want to make everyone aware of this event we're holding. So as you all might know, or if you're new to the collaborative, you may not know this, we are a subcontractor on a grant with our partner, the New York Coalition for Transportation Safety. And in partnership with them, we manage a campaign called Walk Safe Long Island, which is all about law-based pedestrian safety education, which also touches on, bike safety, traffic safety, and now, more recently, micromobility safety. And when we say micromobility, we're really referring to e-bikes, e-scooters, those personal electric vehicles that tend to be pretty quiet and pretty speedy on our roadways. A lot of folks, there's a lot of misinformation about where you can ride, the minimum age to ride. And so the purpose of this event is to bring awareness to the fact that these devices are really proliferating a lot faster than, oh, I'm sorry. Not sure where that's, okay, sorry. So they're rapidly proliferating a lot more quickly than regulation and safety measures around them here on Long Island. So we are partnering with Stony Brook University to hold this event at their Charles Wang Center. And we will have a Stony Brook medicine physician who's going to talk a little bit about the injuries that they see. And we've also invited some local lawmakers. So if you are able to attend, if this is an issue that, is of interest to you, we would love to see you there. If not, we'll certainly be putting out communications after the event. So just wanted to make you all aware.
Thanks, Brooke.
Janine, to that?
No, nothing to add. You covered it perfectly.
Okay, we have a few save the dates here, as you can see. So you might remember last year we held our first poverty simulation in partnership with Nassau County Department of Health. We had another one, and now we are on to our third poverty simulation that we are holding in partnership with Nassau County DOH. So if you have participated in the event before, that's great. And we would love to have you again. But almost every time we have this event, we hear folks say, my colleague wanted to attend and they were unable to. So if you've attended before, please share this opportunity with your colleagues who may not have been able to come in the past, or you're welcome to join us again. And we are still seeking volunteers to participate in the simulation. So if you've participated as a attendee in the past and you want to kind of be on the back end of things and help us this time, we'd love that. Please reach out to us directly and you can register.
I'm so sorry to interrupt, but I just wanted to mention, because I just checked my calendar and I believe that should be April 14th.
Yes.
Is that
That's right.
I just wanted to.
Correct. Yes,
Yeah.
because the flyer says 14th too. I'm so sorry about that. Thank you.
And I didn't catch that either. And I looked at the slides. So there you go. We made a correction in real time. And just to add on to what Brooke said, Nassau County approached us, Department of Health, and wanted to, well, actually, the Office of Minority Health, wanted to see if we would work with them again on this. And of course, we said yes. And they are trying to, and we are trying to as well, get some legislators to attend, because we feel like those who make the policy, those who are the key decision makers, even at institutions, the higher level individuals who are at make the decisions, are so far removed from what happens and what their constituents have to go through to navigate the system. And Gary, I'm sure you work with home care, helping people navigate home care, so you can understand what I'm saying.
Yes,
so
I do.
We encourage and hope that we will have some of those different representatives participating in this meeting. So if there's anyone at any of your facilities who happens to be a bit of a higher level decision maker that you could somehow coax them into attending, it would be I think, a great experience, an eye-opening experience. Every time I go to these, well, the stories you hear. People run out of the vouchers for their transportation. Their child gets sick at school, but they can't leave work to go get their child, and all these little problems that arise in a day-to-day life that a lot of us, we all deal with, but perhaps not to the extent that some of
Mhm.
these disenfranchised and marginalized populations have to deal with. Okay, so just wanted to add that.
And many thanks to Hannah for dropping the flyer in the chat there.
Yeah.
And of course, these slides will be distributed after the meeting and
Mhm.
have the registration link in there.
Yeah.
Brooke, could we just back up for just a second? I just want to ask you a question about the electric, vehicles.
Mhm.
I see that it's at 11 o'clock in the morning, and
Mhm.
forgive me, I heard what you were saying, but did you talk about the legislative component of it? Is there public safety? Is the Legislative Public Safety Committee engaged in it? Because I hear a lot about, so there's sort of two sides to this. There's an advocacy group that I've been hearing about who is talking about this is their only mode of transportation, getting to and from work, people who can't afford a car. There's a whole nother side to this. In addition to the health related components of the safety, and ensuring people's safety. So how are those two groups coming together?
Well, we're working with Stony Brook and have asked them to reach out to their constituent groups. I don't know of this particular advocacy group that you are referring to, Christy, but I do know that we're hoping to have an Assemblywoman Giglio there who has talked about this issue, as well as somebody from the Suffolk County Police Department will talk from a safety perspective. I'm not sure. I'm hoping then that there is an advocate there. Brooke, do you know if Callie has specified if she's reached out to constituent groups like that?
That I'm not sure of. I know when we were initially planning, there was going to be someone there speaking about the safety component, and they were unable to attend. The university specific safety component.
Mhm.
As far as other advocates, that's a great question. I'm not
Yeah.
sure of that specific.
Yeah, I'm not sure. I don't know if it's a group or if it's just
Mhm.
people that are sharing their perspective around it.
Mhm.
But I think it's something very important to keep in mind so that the conversation isn't one-sided.
Right.
I
Mhm.
um
Mhm.
I think it's a very sensitive area because people are using these
Mhm.
these scooters and electric bikes and stuff for their main mode of transportation.
Mhm.
And particularly in Suffolk County, where if it's a bike, they can put it on the front of the bus so they
Right.
can get
Mhm.
around better. So that's my only
Well,
encouragement is to make sure that both sides of the conversation are represented.
yeah. Well, you know what? We'll circle back. And if you know of someone that you would want us to reach out to, even at this late date, we certainly would do that, Christy.
Let me see if I can find, because I'm thinking of one particular person who actually
Mhm.
works on West Campus.
Oh.
I don't know, an 11 a.m. meeting might not be doable for a lot of people because
Mhm.
a lot of people are working, but I'll find out.
Yeah. Yeah, so one of the main reasons why we are having this is yes, there's are individuals that this is their main mode of transportation, but that doesn't mean that there aren't laws and rules and regulations that they
Correct.
need to know about and follow. And that's really what we want to bring to light because we want everyone to be safe. We don't want to say you can't use micromobility and these devices, but be aware that you should, there's certain helmets that you have to use on a scooter as opposed to a bicycle, right? There's different
Yes, of course,
safety,
of course.
all of that.
Mhm.
And there's different speeds you're allowed to go, and there's some licensing issues. So it's kind of all over the place right now. So that's what we want to clarify and bring light to at this gathering tomorrow.
It sounds good. Yeah, and I think it'll be helpful. I
Yeah.
think my sense from the people who I know we're talking about it is that there has to be a balance between the safety component of it
Hmm.
and the regulatory component of it so that we don't go overkill in either
Right.
direction.
Right. See, what happened is they proliferated so quickly that the regulations are now catching up with the usage,
Yeah,
as is often the case. Um,
it's
with
an
lots
interesting
of,
topic.
yeah,
Thank you for letting me go backwards.
sure. Okay, let's move
Back.
on. Where were we up to? Oh, we talked
So we
about
just have
that.
one final save the date.
Yeah, I'm sorry about all the save the dates, but
So this is actually also in the realm of our Walk Safe Long Island work, and it is still in the vein of micromobility. So at our press event tomorrow, we're really
I have the collaborative meeting.
Oh, we're trying to call attention and bring awareness to the safety issues that are currently occurring, on our streets with these devices, and the misinformation, all of that. We are having our fourth annual Walk Bike Long Island Summit, which is going to be focusing on solutions to the problems that we're seeing with these devices and really educating folks about how they can safely and properly, ride these devices on our island. So we're super excited to be partnering with Catholic Health on this event. They have they're going to be hosting us at their Melville facility, and that's going to be on June 11th. So this is really just to save the date, and I wanted to have a registration link up there for anybody who's interested in attending, but all of our formal promotional materials will come very soon.
Okay. All righty. So, Community Health Assessment Survey, which we're going to talk about, as I said, the results of the 2025 data that was collected in just a little bit. And Brooke, you might want to jump in here with me too. What we developed, particularly for the hospitals and the counties that have to do community health needs assessments on a routine basis, on a scheduled basis, we have decided to provide them with specialized, distinct links that will feed up into the main Survey Monkey collector so that they can better gauge how their community is participating, their immediate community and service areas participating, and even allow them, then we can send them the raw data just for their area if they should want to do any kind of specialized reports of their own. Brooke, do you have anything to add to that?
I'll just say that as our first quarter is coming to a close, we will be reaching out to our hospital and health department contacts just to give you an update about how your collection is going, and just to kind of reach out and see, if you have any questions or concerns, or if you'd like to set up a meeting with us to go over anything related to these uniquely.
Yeah, I mean, we're doing this in a way we're hoping to increase the participation rate in the survey. As you know, it's a convenient sample, and we're beholden to whomever is going to take the survey, and certainly to our partners to distributing the survey, which we talk about all the time. With data out is only good as data that comes in. We certainly push it all the time on social media, at different events. In fact, we will be presenting the survey again and asking people to complete it at the poverty simulation because we'll have a captive audience. But just wanted to make you aware of that this is kind of a tool. It's kind of in its test year to see how well it works. And hopefully it increases engagement.
Thanks, Janine. And just some other items that we always speak on. We have our biweekly collaborative communications email newsletter that goes to our contact list. Please send us your free events, your resources, any job listings you may have for inclusion. And there's also a link here to subscribe if you are not yet on our list. Our website also has a free events calendar where you are welcome to promote your events. And we also, as part of our New York Coalition for Transportation Safety work and our Walk Safe Long Island work, and just our regular community health work, we have a Walk with a Doc chapter through the Long Island Health Collaborative. For those of you who are new to the collaborative, Walk with a Doc is a national program that was born out of a physician's idea in Ohio to really kind of walk the walk with his patients, who he was always advising to walk for better health. So we love to partner with anyone who would like to, particularly our hospital partners, to bring a walk to your constituents, to your patients, and then Walk Safe with a Doc. We really hold those with the New York Coalition, and we add an element of pedestrian safety. So we kind of hold those in downtown areas where there are crosswalks, traffic signals and things like that we can also talk about as we walk and promote safety.
Yes, and certainly community-based organizations. we'd love to partner with you as well. We do all the work. I would pretty much say you just have to help co-promote, and we'll find the doctor, we'll find the professional to speak. So keep that in mind as well. If you have a group that you'd like to bring a walk to, and some free time with the doc, the doc walks with everyone and is there to answer questions. So it's pretty cool.
Yes. And two final ongoing engagement items, our Live Better campaign, which you all might remember, which is focused on chronic disease prevention and always has been. We've added more of an emphasis on nutrition and smoking cessation to more closely align with our regional prevention agenda priorities. And we are going to be sharing campaign assets that you all can distribute through your own channels, but we will be posting more resources, more posts, and more content from the Live Better campaign, which you're free to reshare and join us in that. And then our core clusters, the products from those, we are still promoting those. We do get quite a bit of interest in those on our website and a lot of traffic. So just want to reiterate our thanks to all of our core cluster participants who, helped us to build and finalize these products. And
yeah, and remember too, there are metrics we collect with all of these events or programs that we share with everyone that you can use for grant reporting, grant writing, certainly for community health needs assessment and implementation plans, and deciding what's a program that would be good, what wouldn't be good. So just keep that in mind too, that we provide year-end metrics, because there's always an element of measurement in what we're doing.
Absolutely.
More updates? More updates.
They're very brief. Janine, if you just want to run through those quickly.
Safe Streets grant is Safe States. I keep saying Safe Streets, but it's Safe States grant is really spearheaded by NYU Langone. And again, it is all about pedestrian safety, walkability. And Josephine, who is on the call, Josephine, you want to say a few words about that particular grant?
Sure. Thanks, Janine. So we were fortunate enough to receive a seed grant from the Upstream Solutions Working Group of Safe States Alliance. And the project itself will focus on capacity building and advocacy training in the town of Hempstead, where based on our trauma data from our trauma center, we're seeing the most pedestrians struck from the Hempstead area. So we're going to be working closely with Janine and Brooke, as well as with Cynthia, the New York the New York Traffic Safety Coalition, and a community organizer named Jonathan Prevost to do some advocacy training with community coalitions in Hempstead. It is a short grant. It is only funded until September. We have had a few hiccups because our community coalitions actually lost their funding. So we are rebuilding, but looking forward to be able to provide these trainings in the community. And what's really great is that we're building off of content that Long Island Health Collaborative have already produced with the New York Traffic Safety Coalition, and really just tailoring and targeting their advocacy toolkit for the community of Hempstead. So looking forward to start that. Brooke and Janine, you will get an email from me either later today or tomorrow with some updates. But so excited to be working with you all. Thank you.
Thank you. And the Creating Healthy Schools and Communities grant is the Cornell Cooperative Extension has applied for that. And perhaps Serene, you want to give us an update on where that's at? I don't know if she's still there.
I'm here.
There you are.
Yes, we haven't heard anything. I think it is either late April or May that we will be hearing back from the state on it. So nothing yet. Fingers crossed we get it. Yes.
Fingers crossed. And that is exactly what it says. Going and working with the schools and the communities in terms of nutrition and physical activity, to using that kind of socio-ecological approach to making the community healthier through those types of methods, and you have a few partners that you hope to work with, Serene. And then finally, Brooke, maybe you want to talk about this. We were approached some months back from SUNY Old Westbury.
Yes, and they were also, excuse me, our contacts there, they had approached us to possibly partner on, it was a possible grant they were going to be looking to secure. And truthfully, we have not had any really recent updates from them on it. So I just wanted to kind of keep this on the list here to remind everyone that that's another opportunity that might be coming to fruition sometime.
And I think what they were looking to do, if I recall correctly, they were looking to survey particular communities even deeper than what our community health assessment survey does. Am I correct?
Yes, and I wanted our assistance in devising that assessment.
That's right.
So yes, if that's something that blossoms into a partnership, we will certainly let you all know.
Okay.
One last, just to call your attention to Alliance Health Communication.
Yeah. We do most stuff for free, but sometimes we like to make a little money if we can. You can talk about
we just offer these communication services for nonprofits at a very affordable rate. If you ever are in need of any campaign work, any communications assets, we are here for you for that. We would love to talk with you if you have any ideas or any needs that you have not been able to get to doing in-house. We would love to assist you with that. Finally, here we
go. Now, finally, but unfortunately,
yes,
our principal healthcare analyst, informatics analyst, Melissa Bauer from DataGen, had an emergency and was not able to be with us today to go over the nitty-gritty of the highlight of the analysis. And I'm thinking I may try and get her to come back in June so she can go through the power pivot and play around with it, the tool and the platform with each of you, so you can see the power behind it to each of your organizations and what you can glean from it in terms of data for your own needs. But aside from that, I can go over highlights of what was found. And that's what we're going to do the next couple. And I hope we can have a discussion about this because I think some of the findings of what have been finding year after year after year, which leads me to believe, why does this keep, like, how come we can't seem to solve some of these problems? Well, I kind of know why. I mean, funding is a big part of it, but so without further ado, let's just take a look and let's have a discussion about these results and see what rose to the top. So, we were able to get 467 surveys last year, and believe me, we pounded the pavement to try and get that. You can see the breakdown by Nassau and Suffolk. Those who did not identify belonging either to Nassau or Suffolk, we did not include in the analysis. So that's how the numbers worked out. And not surprising, but sort of yes, surprising, and I think I'd like to stop here too and see if we can get some discussion going, is again mental well-being and substance use. Now, this was a question that we added. Which of the following health-related social needs are unmet in your community, to align with the revised prevention agenda and those 5 social determinant of health domains that they are focusing on? And so we asked that as a very first question. And economic well-being is in the top 3 for both, which makes sense. We live in a very expensive area, very high cost of living. But the mental well-being and substance use, again, rising to the top, I think bears us to stop and have a little discussion about that. I heard yesterday that on the radio that the overdose rates from fentanyl, and Christy, correct me if I'm wrong, have been dipping down a little bit again, but only to pre-pandemic levels. or post-pandemic levels. You know, and I know it had dipped and then it went up again during the pandemic, and we're kind of getting back to where we were. Am
Yeah.
I getting that right, Christy?
Yeah, I mean, those of us who sit on the addiction panel in Suffolk County have seen some of the data that's showing that. I think Pam probably has a lot, Pam Mitzi probably has more data on this from the Prevention Resource Center, which is a good thing. You know, any reduction is a great thing to see. It doesn't necessarily mean we should take our foot off the gas.
Right.
Because any improvement that we see, we want to perpetuate. So Pam, I don't know if you have more of the more specific data at your fingertips.
Not at my fingertips at this time, no, but the rates declining are encouraging, but they're still way too many.
Right. And I sit on that same task force, although I have to be honest, I think I missed the last couple of meetings, so forgive me, my fellow task force members who are on the call. I'll try and get there the next time.
So I wanted to ask Janine on this issue. Can I?
Sure.
So one of the things that I saw the report, not from New York, but from Connecticut, that one of the reasons for the reduction that they are saying is the distribution of the Narcan kits. So they are attributing the percent to lowering the death rate is by the availability or the availability of the kits. Is that one of the data variables that you have seen being used? Cornell also has an opioid prevention grant, and we also do the same. We do a parent education program, for teen youth. So it has been very, very successful, but our most successful is the Narcan training in 2 or more languages that we are doing, and the distribution of the kit. So I would be interested in listening to more that in your information, what is the biggest variable in the reduction?
Yeah, I mean, I don't have, again, I was just, had heard this news report yesterday, so I don't know. I don't recall them mentioning the Narcan as being a significant, the distribution of Narcan kits as being a significant factor in the reduction, but it does make sense. However, that still doesn't get to the root cause, right? So we're reversing some of these potential overdoses, but it's still not getting at the root cause of what's causing people to fall into the addictive patterns anyway. But yeah, that would be interesting. And maybe Pam has that data at hand and she could share it with you, Zareen, at some point. But I don't have anything that I know of, but I could dig it up if you needed me to, but I'm happy to do that. Oh, there's a panel tomorrow at 2:00. Pam is telling me. Oh, but I'll be at Stony Brook. We'll see. I'll try and make it.
Before we move on from this question, I thought it might just be a little helpful to draw the line between these categories and our prevention agenda priorities that we've chosen as a region by consensus.
Okay.
So one of our first priorities is tobacco and e-cigarette use, and these were all chosen by consensus based off of our primary data that we collected during last year's CHNA cycle. So tobacco and e-cigarette use falls under mental well-being and substance use, which, as you can see, was ranked first in both counties. Our second regional priority is nutrition security, which falls under economic well-being, which was, of course, second for Nassau and third for Suffolk. And then our third priority is preventive services for chronic disease prevention and control, which falls under the category of health insurance coverage and access to care, which was fourth in Nassau and second in Suffolk. So I just wanted to connect those dots quickly for everybody.
Yeah, that's helpful, Brooke. And the individuals who took this survey had no idea about priorities or that the tobacco or e-cigarette use fell under, what did you say, mental well-being and substance use section. So they didn't make that connection, but it's interesting to see that in this revised prevention agenda priority that the state unleashed, or I say unleashed because that's what was a massive undertaking last year. It's encouraging to see that the responses we got from the community align to some degree with the priorities, which there are now 24 that the state has set forth and asked counties and hospitals to choose from collectively to work on in a region. So that's a little encouraging. But just before we leave the mental well-being and substance use, did anyone hear about that case? I don't know if I think it was in California, it might have been Texas, could get my states wrong, about the Silicon Valley social media platforms. I think it was Instagram, Meta, basically, was sued by this woman named Kaylee, a young girl named Kaylee. She was actually, I think, I don't know if it was a class action, but she was representing lots and lots of young individuals. And she claimed that that she became addicted to the social media platforms, and they worsened her depression, her anxiety, and the jury ruled in favor of her and her attorneys in this collective group that are suing, and awarded $6 million. So they said it's kind of akin to what happened with the tobacco industry at the end of the 1990s when they were accused of marketing specifically to younger individuals, and then there were lots of reforms put in place and they could no longer market to the young kids, but they kind of got around that once vaping and all that stuff started, but that's beside the point. And then there was that tobacco money settlement, which was used for and continues to be used for a lot of tobacco prevention efforts. So I heard about that case yesterday, and it kind of stuck in my mind because I knew that we had mental well-being and substance use at the top of both Nassau and Suffolk County. And then there was another case related to that, again, and I believe maybe that one was in Texas, where the social media platforms, they proved that the algorithms were designed to basically entrap the younger people, and they were not being as transparent as possible, and there was an award in that case as well. So two significant court cases linked, and in this case, I don't know if any of my colleagues would disagree. Social media, I think, is a big factor in a lot of the mental health issues that the youth are experiencing at this point in time. Nadine, maybe you could speak a little to that since you deal with youth mental health, hopefully to prevent through predictive behaviors the onset of that.
Yeah, there's so many layers to what you're talking about. So we are looking at those bigger studies and how they're impacting folks, but then when it comes to really applying this in the community, there's an example right now. We're working with Eastport South Manor School District and the Long Island Explorium here and they created a curriculum around basically the negative influences of social media and how to improve the overall mental well-being of third grade students as before there are any kind of triggered symptoms or negative social comparison and gaming addiction, some of these things. And they specifically chose third grade as a possible tipping point. So it's an exploratory model right now. What we've done is assess the root cause, and we developed a custom assessment for this specific program. And then we've also measured that against our 5 elements of systemic well-being measure so that we can see if these kinds of types of strategies reduce the negative impacts of social media. So that's just an example of, when it comes to kind of putting this into practice, I think we need to look at
the specific triggers in geography. We need to look at the social determinants that affect that group. We need to look at age and things like this. So it becomes that kind of a translational research need from, these big challenges into daily practice.
And that's the South Manor School District, you said?
Eastport South Manor, yeah.
Eastport South Manor. And that's happening, it's in progress right now that you're doing? Yeah. So you'll have results at what point, like that you could?
We should have results in June to be able to share and how this programming is going. And I think, the Long Island Explorium is known kind of just for their science experiential learning models. And so they're taking that to social and behavioral science, which is really exciting, I think. And they're well positioned with school districts to be able to do that. And it's great that they're using this kind of third-party analysis, and we're building like these technical dashboards and stuff for them. So we'll definitely be able to share that. And I know that they want to do a symposium at Stony Brook afterwards. So maybe we'll be able to invite some folks to participate and listen in.
Thanks, Nadine. I know you're very deep into the research in this area, and I knew you'd have something very astute to say about it. So thank you for that.
About that. It's a work in progress.
Oh, I know about that. Yes, you blow my mind, Nadine, with what you're doing. So let's move to the next question. If there any other discussion on question 1? No? Okay. So then, okay, so question 1 now. Question 2, what are the biggest ongoing health and/or social concerns in the community where you live? And the respondents could choose up to 5. And so
all right,
these were the top ranking ones. For both Nassau and Suffolk County. And Suffolk, again, it's the drug misuse and overdose popping up there. Cancer is always way at the top, and that kind of falls into a lot of the chronic diseases as well, because many cancers are now like a chronic disease. In Suffolk, mental health is still in there. Obesity, weight loss, and heart disease is lower in Suffolk than it is in Nassau County. But the fact that cancer rises to number 2 in both, I think, is telling. Dr. Mermelstein, would you want to maybe comment on that, since you're at Stony Brook's Cancer Center there?
Yeah, I mean, it's understandable. We actually have, Long Island has, meaning Nassau and Suffolk, has the highest cancer rate, higher cancer rates than the US rates for about the top 14 or 15 cancers.
Wow.
We have the lowest mortality rate, probably because we have so much healthcare on Long Island. So I could understand it being a concern for the community. And there's many different causes and risk factors that explain those those rates. And a lot of them are things that we've covered in terms of our priorities, diet, exercise, activity, stopping alcohol, just many, risk factors, knowing what your risk factors are, and doing appropriate screenings. There's so many different things go into those numbers. So I could see why that would rise to the top in terms of concern. So everybody knows someone with cancer.
Yeah. So those modifiable risk factors that the collaborative has been pounding on for the past 10, 15 years, dare I say that collectively all of us can take a little bit of credit for what Linda is saying in terms of we have the highest rates, but the lowest mortality. So a little bit of encouragement there. So
yeah, there's also some crossover in terms of, our concerns about mental health. This is a very stressful time. The last couple of years have been stressful. Every time you open up the news, there's bad news. So I think that crosses over because there's a lot of misinformation and disinformation. We have concerns about lower rates of vaccination for HPV vaccine, which prevents cancer, hepatitis B vaccine in newborns, which prevents cancer. So we're really trying to focus our educational efforts on preventing future cancers, because right now it's not going to make a difference, but another 20 years, now we're going to have a whole new cohort of people who are at higher risk because they didn't get vaccinated now. So really trying to focus on those things.
Any other discussion about question 2? Anything, is anybody surprised? Just sort of what you expected? Okay, we can go to question 3. And this asks, what are the biggest ongoing health concerns and or social concerns for yourself? So this is what you see for yourself. And interesting in Suffolk County, and again, it's convenient sampling, so it depends on who's taking the study. Women, this is a survey, women's health and wellness is way at the top. It's heart disease and stroke in Nassau County. We've got some in Nassau County, some chronic disease issues, and of course, obesity and weight loss, which are indicators for chronic disease, obesity. And again, there we have our anxiety, stress, right? So the prevention agenda this time around got a little more specific when they were asking questions. So we got a little more specific in asking some of our questions and not just saying mental health and wellness, but what is it? Is it anxiety, depression, anxiety and stress? Is it depression? So we see anxiety, stress, which if what Linda just said is so true, every time we turn on the news, it's there's a lot of bad news out there. So there is, I think, a lot of anxiety and stress overall. Any questions about question 3? Anybody? No? Okay. Hannah or Brooke, you have anything to add to question 3?
I'll just say the reason why my screen went a little haywire before was because I was trying to pull up last year's summary just to kind of see where the differences lied. So I will open that now if we just want to see, the difference between last year's results and this year's. That's opening right now.
Okay.
Right, because we had heart disease and stroke, and then let's see. So for the this is for yourself. So last year, we also had heart disease and stroke in Nassau, and in Suffolk, it was also heart disease and stroke. So not much has changed there in at least one county.
At least in one county, although heart disease and stroke is still in the top 5 in Suffolk County.
Yes.
Yeah, and what we will do, we will do a year-over-year, we'll probably go back and we will do a comparison. Oh, look at this. Now my computer wants to restart. Okay. We will go back and do a comparison looking at previous results and comparing and see what's moved up, what's moved down, and provide that to everyone. We usually do that. And we also reach out to the media to get some coverage of this, which we have gotten in the past that been interested in this. Because it is a very localized survey of the needs of, and speaks specifically about Long Islanders. And on the back end of this, when you look at the power pivot model, which I don't have our data analyst here to show you, you can see, you can slice and dice a lot of the data by zip code, gender, other socio-demographic factors, income, race, ethnicity, sex, all of that. So you can get customized reports for yourself.
And that will be published on our website after this
meeting. All that's on our website, right? But I always like to have the data analyst here to go through the whole power pivot model to refresh everyone how to use it. I mean, it takes a little bit of getting used to. If you have used it in the past, then you're great. You know what you're doing. Those of us who don't use it on a daily basis kind of need a little bit of refresher on it. And so she's always great to do that. And I might see if she can come back in June and just do that for us, just take us through a couple of scenarios. Okay, so that's question 3. Any other discussion around question 3?
That's a great question. Looking at the data set in Suffolk County, for example, when you look at women's health and wellness versus cancer, how do you differentiate? Because I guess in women's health and wellness, for example, some preventative screenings could be considered part of that, but they're also cancer screening. Is there any differentiation, or how do we particularly denote that?
I don't have the question right, the choices right in front of me, but if I recall correctly, these align with, as I said, the priorities set forth by the state, the prevention agenda, and Women's health and wellness. I just want to see where that falls.
While Janine is looking at that, I will say one of our other questions coming up is about what screenings do you feel are most needed, in your community? So I do think it gets a little bit more granular there.
Yeah. When that choice is selected, I think people are thinking about women's health in terms of reproductive health, uh, anything related to perinatal health, postpartum, menopausal health. That's what that is about.
Non-inclusive of cancer, since that is its
Gotcha.
own response.
Yeah. Thank you.
Sure.
Question 4. Okay, so this is what prevents you and your family from getting medical treatment. And look at that, no barriers, which we haven't, have we ever had that in the past? I don't think so. I don't think that's ever been the number one, ranked number one in the past.
Actually, so it is pretty interesting. Last year, we did have that outcome as well. And I think we did have a discussion about how that speaks to, the respondents that are answering this survey and, where it is being distributed. And there is a little bit more, there's a much greater demographic breakdown in the Power Pivot model that you can look at when that is published. So that will also likely shed some light on why that is. Particularly the health insurance rates. I'm interested to see how folks answered that response to kind of lend more context to this answer.
Yeah, adding to what you, Brooke, are saying, most of the people who are answering are people like us who are employed and have some kind of insurance through their employer. So if you go to another demographic in another town where people have various jobs, are on per diem or daily wage workers with no benefits, employer benefits, you will have a very different answer.
Yeah. Which is why we depend upon all of our partners to distribute the survey. We've got a toolkit, a social media toolkit where you can just grab a post that has a link in it or a QR code to your individuals and constituents you work with, so we can get as much of a cross section represented as possible. And that's why we're always pushing it. Lack of availability of provider appointments, I don't think is a surprise, right? I don't, in my own life and in my own experience, it's taking longer and longer to get some specialist appointments. I'm noticing, and even primary care, when you have an immediate problem, it's not always you can't always get in the same day when you really need to see somebody, because that's when you have the problem, and you end up going to urgent care, which it's okay, but it's not the best. Oftentimes you go to urgent care and they ship you off to ER anyway, but I don't think that's a surprise there. What does anyone have anything to say? What do you think about that? I don't think that's too far off the mark. And in fact, when we do community health needs assessments on behalf of hospitals and counties throughout the country, through another service line that we have. And we find that over and over again, lack of availability of provider appointments, particularly when we might be speaking to individuals from a rural area. I mean, that makes sense. But even here, right, we're in the very dense suburban area. And when we even speak to individuals in other cities and other suburban areas, that is always a problem. They always talk about the lack of availability of provider appointments, and it's a lack of providers. That's always something that comes up.
The only thing I was going to add, Janine, is that, I mean, I think that adds up with what we're saying about the individuals who are answering this survey. You have to know how to make that appointment. You have to know what sort of specialist you're looking to see to even get to the point where you realize that there's no appointments available for X amount of months. So I think those first two choices really align with sort of the sample size that we have on this survey. The one thing that kind of comes as a surprise maybe is 3 in Nassau County being misinformation or lack of health literacy when we're thinking about a sample size of individuals who know how to navigate the healthcare system, then also kind of reporting misinformation or lack of health literacy, which I guess the way that the question is phrased, it's what prevents you and your family from getting medical treatment. So maybe ourselves, that it might be different from, our mom or sister. That could certainly, you have to be able to recognize that what you're seeing is misinformation or there's a lack of health literacy there to even understand what health literacy is. So I think that's the one thing that stands out to me on this question.
Okay.
Yeah, I think that's valid also for, some of the things like you could be very well educated and you could have, be in your 40s and have rectal bleeding and go to your provider and they say, oh, it's just hemorrhoids. And then you'll go for another year without getting a colonoscopy when, you didn't realize that maybe that wasn't the best advice. So there's a lot of, even literate people can lack health literacy or understanding, or people tend to, you get a little chest pain, you're like, oh, that's nothing. Oh, it's, because I worked out too much, but not realizing that you should probably get it checked out to make sure it's not a cardiac thing. So.
All right, so I think there's a couple of more questions. 5 is which of the following is most needed?
These options are really more, they were all like environmental resources that were listed.
Yeah, to improve the health of the community. And clean air and water is in the top 1 and 2 for both counties.
Health screenings, which we'll dive into in the next question.
Yeah, health screenings too, and recreational facilities is 3 for both. So that's interesting. So health screenings, which Linda was just talking about, right? So if you see a problem or you get screened on a routine basis, right? We know we have to kind of depend on knowing ourselves or the communities that we're serving that they are hopefully seeing primary care physicians who are reminding them about their screenings. Don't know how well that happens, or I'm sure, or if it's happening at all. Recreational facilities, right? So people, that's kind of interesting. We have so many hiking paths here on Long Island, lots of recreational areas. That's a little interesting to me. And the clean air and water is a bit interesting that it's in the top 2 because both Nassau and Suffolk, I think their water is rated pretty well, that it's pretty clean water. So, and maybe the air I could see. Anyone want to jump in and talk a little bit about that? What do you think is going on there?
I agree with you. The water is fabulous in Nassau and Suffolk. I mean, unless you're using your own well water out in the far east end, or Suffolk County Water Authority and Nassau County Water are excellent. Well, but we do have like smoke days that come from Canada from fires and stuff.
But there may have been, when the survey was done, there was that whole controversy about the 2 plants. If the water, especially in Suffolk, there was this big discussion. Then the second layer was the fluoride and not to have fluoride in the water. So it was in the news a bit.
Oh,
and
yeah.
sometimes you are skewed with what is in the news with what is really on the ground. There were just a couple of towns that were in discussion. So that could be one of the reasons. But you also have to look at the percent. There's a large percent difference between Suffolk and Nassau. 32% is a very high number compared to, we don't have any data comparable to that number in Suffolk as it's more evenly distributed. So that could be also that the news may have skewed you towards what was currently discussed.
Hi, you guys. This is Nancy. Yeah, there's definitely been issues in Nassau County. You have the Grumman facility and the leaching into the groundwater through the ground, and that remediation is going on for a long time. And PFAS issues, the forever chemicals, are very big news now all over the place, specifically in Nassau. So it's true, we have the deepest aquifers around. and mostly really, really clean water. But the perception and some of the real PFAS issues, at least I can only speak for Nassau County, is significant. I mean, whenever an issue happens in the city of Long Beach, the people are up in arms. So perception is often, right, more significant than reality.
That's really what I wanted to call out too, is that sometimes these survey responses, it's not necessarily giving us, the actual statistical prevalence of these things, but more so the public perception surrounding them. So, and of course, that's something that the secondary data doesn't always reveal to us. So it's kind of an added.
Yeah.
And one big factor is also that where you work. If you are in an old county building with very old pipes, you tend to say, I'm never going to drink this water that comes out of. So water becomes a very big concern. Even you will not put it into your, to boil it or use it for your coffee or tea or whatever.
Yeah, and I think that whole idea of perception, that is what these surveys were designed for, to solicit individual and community, an individual's perception about their individual health and their community's health and their family's health. So it is all about perception. And yes, it can be skewed depending upon when the survey, where it was distributed, who took the survey, all of that. So that's why this is a supplement to secondary data that
I see Amelia had her hand raised if you wanted to add something.
Yeah, I just, wanted to speak to recreation facilities. You mentioned that, that's another odd one because you're right, there are so many wonderful green spaces on Long Island. So I was thinking about that a little bit. And so a couple things come to mind, especially in terms of like Long Island has a lot of almost like gatekeeping of some of our green spaces, especially when you think about the beaches. So like I'm a big swimmer. That is my favorite form of exercise. I have yet to find like a good like affordable way to do that in the winter, like at an indoor space. So that's more so like the facilities, right? There aren't a lot of like indoor facilities that are affordable for exercise and stuff in the winter. But then in the better weather, beaches, right? Like you need to either be a member of that town, a resident of that town. I know in my community, I actually cannot use any of the beaches within my like little hamlet because I'm not a member of like the property owner association, right? That's like another gated, like if you don't own property, if you don't pay into, I know some of the townships that have town, like they're all under the town. You can only park there if you are like a member of the town or have that. And then I know one resource that we learned about this summer that was really cool. It was through a grant at Stony Brook University, and they were providing free transportation to West Meadow Beach for folks who had transportation barriers or just didn't have, that town of Brookhaven permit. I think they had to live within the town of Brookhaven, but it was, they didn't have, because the permit's like whatever it is, like $35. It keeps going up and up, right, every year. Or even just, transportation, a car. A lot of our beaches are not accessible through public transportation. West Meadow specifically is one that is absolutely not accessible by car. And so those are some things that come to mind there in terms of like, so I could see how recreation facilities is coming, up in that way. Like we have a lot of the spaces, but are they accessible to all? And then, thinking of the seasonal shift as well. I live right in walking distance to the beautiful North Shore Rail Trail, which has only just been usable because it's been completely covered in snow, right, for the last 6 weeks, and it's not plowed or anything like that. So that's like a nice resource that we have that, of course, was not usable during that time. So that's just my thoughts on that.
Well, thanks for that perspective, Analia. Yeah, that makes sense. I forgot all about the seasonal issue and the fact that many people perhaps can't afford a gym membership and whatnot. So I think is there one more question? Is there one or two?
Georgette has her hand raised as well.
Oh, I'm sorry.
Yeah, I might have missed this at the beginning. I did see the total number of respondents as well as the breakdown for Nassau and Suffolk. Is there a summary of the types of people who responded to the survey?
Yes.
And like the zip codes, because it's kind of interesting in looking at the differences like we were just talking about, and affordable housing, I guess, only really shows up on the Nassau side versus Suffolk. So I was wondering if it was more, people like us who are in offices who answered the survey, or, is it more from like a community perspective, meaning just general folks at libraries or wherever?
We do have a full demographic breakdown as well as a zip code level breakdown in the Excel Power Pivot model. So that is what's going to be published on the like site after this meeting. So you'll be able to play around in there. And we also do have a tutorial on that same webpage where you can kind of see our data analysts go through the model. And we're also readily available to, if you wanted to meet with us or discuss those findings once they are online, we'd love to do that. But yes, that is in the data set.
Oh, thank you.
I just had one more comment about the clean air and clean water. For maintaining clean water takes a lot of resources. So the question is, what's most needed to improve the health of your community? So it is valid to say clean water because we have to put the resources in. I was at a meeting related to the Grumman area pollution, and they were saying the water is so pure and clean there, but we have to make sure that people still pay for that, and it comes out of taxes and grants to the water authority. So maintaining those services is expensive, and it's still important to improve the health of the community.
Absolutely.
All right, what's our next question?
This is our final question.
All right, health screenings or education information services are needed in your community. And Nassau is looking for in cancer, diabetes, blood pressure, all chronic disease related, whereas in Suffolk, we're back to drug and alcohol misuse, and then followed by pretty much again, and suicide prevention is in there too. So that's interesting.
I'll say last year, cancer was the top answer for both counties.
Right.
So
Right.
A little bit of change there.
There's a little bit of a change there. So I don't know if anyone has anything else to say. And again, hopefully we can get the data analyst who will go into the back end of this and play around with the power pivot with you. Perhaps I can get her, to spend 15, 20 minutes doing that just so you can get a sense. But again, as Brooke said, this is all available to you after this meeting, the entire report with the zip codes, with the summaries of the demographics, the summaries of how many male, female, age ranges, all of that will be on our website, and you're free to look at that. And of course, all the prior year's information is there as well to draw conclusions and see trends and whatnot.
Yes, and I will just drop the link to that page into the chat right now, but it will also be in the summary that we send out and the slides, of course. Thanks to Laura for your thanks in the chat.
Thanks to Laura. Any other? Oh, okay, here we go.
We're more than welcome to, we can definitely discuss. I just kind of wanted to have these dates up there while we do discuss anything that we want to.
Yep, so, and you've gotten, I think, invites for all these dates, so they should be held on your calendar. Is that correct, Brooke?
No. So actually you do have to register to receive
your
invite for these. So please do register at your leisure. Also, if you'd like to register for all, we totally understand if you're unable to make some. But yeah, feel free to register and have the hold on your calendar. And we hope that you are able to join us. And I'll also drop the webpage with those links in the chat here too.
So I did tell you that you would get some time back, and you are getting a half an hour back of your morning. I appreciate everyone hanging in there with us through this meeting. A lot of meetings, and there's a meeting this afternoon that Northwell's holding its Community Health Advisory Task Force chat meeting, whatever it's called now. So I'll probably see a lot of you on that one as well. So I appreciate the time that you spent this morning with us, and we'll see you again in June, and reach out to us in the meantime for anything.
Yes, thank you all.
Thank you.
Thank you. Great to meet everyone. Have a good one.
Everyone. Bye.
Thank you.
Thank you.
Bye.